My name's Dr Amandeep Grewal, and I'm a senior GP in the London and Berkshire area. I'm quite a sciencey person, and I always want to do something in public service, and medicine gives me a perfect opportunity to do that. I love meeting new people. I love finding out about people. I love trying to help people. And the fact that I'm very science-minded, biology was my favorite subject at school. It was always going to be a natural choice, and I've never regretted my decision. I feel privileged every day to help the public, and I really want to do that for as long as I can. I find all of medicine interesting. Every specialty that I did, I thought was excellent. They all had their own advantages, areas of interest. I think focusing a lot, which is where medicine has gone now, I think specializing into a lot smaller areas, I think I might find myself a little bit limited and potentially a little bit less challenged than I like to be. So general practice, you deal with anything and everything, and I love that. You know, no day is boring. No, there's no way I can sit there and say, well, look, you know, I'm amazing. I'm the best in the world at my subject, but I'm a little bit bored. I never want to be in that situation. So there's always new things to learn. There's always developments in so many areas, and the other thing is being a generalist, a specialist in primary care, as we might describe it. You can pretty much help anybody with anything to a greater or lesser extent. If you need a specialist involved, you can do that, but a lot of things you can deal with. So that's always nice to be able to offer people as well. I think just being able to connect with people. People might have waited a long time to see you. People come in, they're nervous, they're worried, they think there may be something serious wrong with them, and being able to let them make a connection with you, let them feel relaxed, let them express themselves. They may feel uncomfortable talking to family or friends, the people that they normally might talk to about other things. They might be embarrassed about their situation. The fact that you have an opportunity to do that, to allow them to express themselves, to allow them to get their worries or their fears off their chest, and to be able to help them with that, I think that's a privilege. And to be able to do that so many times in a day, you know, most days of a week, I can't say that I can think of much more that's more enjoyable and a privilege than that. I think, I mean, we do actually assess this on a regular basis. I mean, we get feedback. People can leave anonymous feedback on a regular basis about us, and it's really interesting to read that actually. I think, I mean, I try to take quite a relaxed approach to life. I try to put people at ease. I think they might say, and they have generally said that I try to listen. I've got a golden rule that I try to use as much as I can, which is the golden minute. Just don't say anything for a minute. Introduce yourself, sit down, let somebody open up, give them enough time to just let them get on a little bit of a roll, let them get the confidence and start feeling a bit more comfortable, because that doesn't happen immediately. So let them start talking, let them, and then just try and guide their questions without being too intrusive. I think that's something I've worked on, and I think has been a strength of mine since the training days. I was always fed back, so that's something I think my patients probably value about me, and obviously that they have to be happy with what I'm doing, with my decision making, with discussing their options with them. That's something, you know, if you start off well, but then you finish off, you know, and somebody's not satisfied, they're not going to come back to see you. So, you know, again, the fact that people do like to come back, and once you've built the relationship, they feel more and more comfortable with it. That's great, you know. And they say in general practice, cradle to the grave, and you know, if you're around long enough, you know, you will see people from very early in life, maybe till they retire and even longer, you know. So again, you know, an absolute privilege. I think treat others as you would like to be treated yourself. You might see somebody that has not seen a doctor for 15 years and may not see another doctor for another 15 years. You're representing yourself, you're representing your profession, you're representing someone who's supposed to be, you know, have a passion about public service. And you really need to, after every consultation, just reset, have a think, try and be as fresh, and try and be your best self for everybody. Because even though maybe sometimes, you know, what happens in a consultation, you find out things that maybe be a bit worrying. You can't possibly solve everybody's problems every single day. But if you can make the experience good for people, that's something that's crucial, because it might be difficult stuff. You're having difficult conversations every day, but if they feel like, look, actually, I had a good conversation today and I came away from that really feeling satisfied. It might be not very good news at all sometimes, temporarily, before you can actually, get to the point where you've actually solved something for someone. But if they can enjoy the experience, and if they can come away from it nervous maybe when they came to it, but come away from it comfortable and happy to have another conversation with you, I think that's really important. If you don't achieve that, then you're already, the experience is not what it should be, I think.